We will be covering what are the common etiological bacteria or microorganisms for that infection. What are the indications to start antibiotics? Which antibiotic to select, and what will be the dose of that particular antibiotic? This video is only for the educational purpose of healthcare professionals, and patients are advised to consult their doctor. Starting with the infections, common infections from head to toe, like meningitis, endocarditis, pneumonia, upper respiratory infections like throat infections, skin infections, diarrhea, typhoid fever, urine tract infection. So we will be covering what are the indications of antibiotic in these infections and how to select a proper antibiotic in a very precise and concise way. Starting with meningitis. Meningitis, common etiologies are Streptococcus pneumonia and N meningitis. Antibiotic that we give empirically is a combination of vancomycin, which is 15 milligram per kg twice a day. Along with that, we can add cephalosporin, ceftriaxone 2 grams twice a day. Important role of dexamethasone, that is steroid indication here. It should be given for Streptococcus pneumonia meningitis, and the first dose should be given within 10 to 20 minutes before starting the antibiotic. This is to prevent the CNS complication like hearing loss. For acute endocarditis, the common etiologies are Staph aureus, Streptococcus group. Antibiotic to be given as empirical antibiotic. The definitive antibiotic will depend on the culture sensitivity, but before the culture came, we will go for empirical antibiotics like vancomycin in a dose of 15 milligram per kg twice a day. Along with we can give cephalosporin, cefepime, we can give 2 grams TDS. Now coming to the community acquired pneumonias, like a patient being treated in OPD, IPD or ICU. So in OPD, the common etiological agents are Streptococcus pneumonia, the most common organism. It can be atypical pneumonia like Mycoplasma pneumonia, or it can be H influenza, chlamydia. So if patient does not have any comorbid conditions, we will give amoxicillin 1 gram 3 times a day, or azithromycin 500 milligram day 1, then 250 milligram once a day for 4 days. Or we can give doxycycline 100 milligram twice a day. With comorbid conditions, patient should be put on a combination of amoxicillin and clavulanic acid 1 gram twice a day plus macrolide, that is azithromycin. The dose will be the same as in the patient with no comorbid conditions. Or we can give levofloxacin 750 milligrams once a day. But in Indian scenarios, we first rule out tuberculosis before starting any fluoroquinolones. These comorbid conditions include chronic heart disease, lung, liver, or renal disease, diabetes, alcoholism, malignancy, or spleen removal. For a patient who is admitted in IPD, in non-ICU settings, common etiological agents are same as for OPD, along with the atypical pneumonia, Legionella pneumonia. Antibiotic to be given respiratory fluoroquinolones like levofloxacin 750 milligram IV once a day, or we will give beta-lactam antibiotics like ceftriaxone or MP sulbactam combination along with macrolide. In the Indian scenario, we prefer giving the this combination more than levofloxacin for a patient of pneumonia. In ICU settings, common etiologies are same as the IPD. Along with that, Staph aureus will be another possibility. Antibiotic will be beta-lactam antibiotic, same antibiotic which were given in the IPD patients, along with the macrolides or a respiratory fluoroquinolone. But if methicillin resistant Staph aureus is a consideration, then we have to add vancomycin. Daptomycin should not be used in patients with pneumonia. Hospital acquired pneumonia. In hospital acquired pneumonia, common etiological agents include Staph aureus and gram-negative bacilli like Pseudomonas or the Klebsiella pneumonia. Antibiotics empirical to be given are anti-pseudomonal agents like ceftazidime, which is 2 gram 3 times a day, or a combination of piperacillin tazobactam 4.5 grams every 6 hourly. Plus, we will add fluoroquinolones, or we can give aminoglycosides to cover the gram-negative bacilli like amikacin 50 to 20 milligrams per kg once a day we can give. Upper respiratory infection. So for upper respiratory infection, you can watch our video of earlier videos where we have discussed what are the types of respiratory infection, how to diagnose the respiratory upper respiratory tract infections, and which antibiotic to be given. So details are also mentioned in that particular video. So for upper respiratory infections, sinusitis, streptococcus pneumonia, H influenza are the bacteria which leads to sinusitis. But the indications indicate not in all the cases you will be giving antibiotics. So indications are when the fever is more than 102 degree Fahrenheit along with purulent pus discharge or pain which is persisting for more than 3 days. Antibiotics are amoxicillin clavulanic acid 1 gram twice a day for 7 days. For acute pharyngitis, it is group A beta hemolytic streptococci, indications being the criteria, the center criteria, which we have already discussed in other videos: fever, absence of cough, tender cervical lymphadenopathy, or tonsillar swelling or exudate. If all four are present, then it is more likely bacterial infection. In that scenario, we will give antibiotic amoxicillin 1 gram 3 times a day for 7 to 10 days. Skin and soft tissue infections. Common etiologies are Staph aureus and Streptococcus pyogenes. Antibiotic to be given, we can choose any of these antibiotics which will cover the Staph aureus and the Streptococcus pyogenes, like cephalexin, clindamycin, or neficillin or oxacillin we can give. And the duration will depend on the healing, or we can say antibiotic will be given for say 7 to 10 days. Diarrhea. If a patient has diarrhea, the common organisms are Campylobacter jejuni, Shigella, Entamoeba histolytica. This is important for Indian scenario. Yersinia. Now the indications of antibiotic, because not all the diarrhea patients need antibiotic, because these diarrheas are due to toxin induced, and that is self-limiting. Only thing which we have to consider is the fluid and electrolyte balance that should be maintained in all the patients of diarrhea. So giving the antibiotic will unnecessary predispose for antibiotic resistance. So the simple indications for the starting the antibiotic is the presence of the fever and blood in the stool. So just ask the patient these two points, fever or blood in the stool. If any of these are positive, then we can give antibiotics like fluoroquinolones, ciprofloxacin 500 milligram twice a day, or norfloxacin 400 milligram twice a day. And for Indian scenario, we have to add metronidazole 400 TDS or ornidazole 500 milligram twice a day. And these antibiotics, according to the Harrison textbook, should be given for 3 days. They have mentioned 3 days duration of these antibiotic for diarrhea. Typhoid fever. For typhoid fever, Salmonella typhi is the most common organism, and we usually prefer giving cephalosporin in India. So ceftriaxone injectable 1 to 2 grams twice a day, or cefixime can be given 400 milligram twice a day. So the dose of the cefixime is 400 milligram rather than the usual dose of 200 milligram. And most of the physicians, they do add azithromycin suspecting the resistance. So azithromycin 1 gram day 1, then 500 milligram once a day for next 6 days should be given. And the basic rule is for how long these cephalosporin should be given. The rule is give cephalosporin till the patient is afebrile for 2 to 3 days. So till that time it should be given. Urinary tract infections. Urinary tract infection, the most important organism is the E. coli, and depending on the site of urinary tract infection, like whether it is cystitis or pyelonephritis, and also whether it is complicated or uncomplicated UTI. So in cases of uncomplicated UTI, that is in females, and other conditions of complications are ruled out, like any urinary tract abnormality, pregnancy. So these should be ruled out. The antibiotic to be given is nitrofurantoin twice a day, 100 milligram for 5 to 7 days. If complicated UTI, complicated is key in males, any structural abnormality associated with any renal stones or any benign prostate hypertrophy, or in female pregnancy. So these are complicated. So ciprofloxacin twice a day, 500 milligram for 5 to 7 days, levofloxacin for 5 to 7 days. But important thing is कि in pregnancy, do not use fluoroquinolones. In pregnancy, we give either nitrofurantoin or amoxicillin. For pyelonephritis, uncomplicated cases, we gave fluoroquinolones for 5 to 7 days, levofloxacin 750 milligram once a day for 5 to 7 days. In complicated cases, we gave injectable agents like piperacillin, tazobactam, 4.5 grams 3 times a day for 2 weeks. So these were the common infections and the antibiotic use. So if you want to share your experience, you can write in the comment box. Thank you.